Welcome back to 5 Questions with an ISHLT member for our first interview of 2022. So happy New Year to all of you. I'm Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And I'm here today with Jean-Luc Vachiery. Hi, Jean-Luc, how are you?
Hey, Jess, I'm good, thank you.
Good to see you. So before we dive into our 5 questions, would you mind sharing who you are, what you do, and what your role is with ISHLT?
Sure, with pleasure. Well, first of all, thank you for having me. I think this initiative is really great. It's helping all the members to know each other better. And I think with the early career last year, it was really nice to see so many young investigators and young doctors having an interest in those end-stage pulmonary and cardiac diseases that we take care of. And that has been, at least for people like myself at my old age, the foundation of our career. So I am a cardiologist by training, and I'm currently leading the heart failure and pulmonary vascular disease program at the Erasme Hospital, which is the academic hospital of the Free University of Brussels, and I've been in that position since 2008. Before that, I've done a lot in the field of heart failure and pulmonary hypertension, working in the fundamental lab and participating in many trials and mentoring young doctors who are coming from several places across Europe, which is basically what I've been doing for the past years.
Well, fantastic.
Now, ISHLT, if I can follow up on ISHLT, yeah. It's funny because I've been involved. My first meeting was in 1994, I think, was kind of a long time ago. I was a young resident at that time, and I did get that the society has this special feel and this different from other scientific society to be very much inclusive of many people and from different background. And this is why back in the early 2000s, I became the co-chair of the Pulmonary Hypertension Council, the very first one, for a couple of years. So I've been involved with the ISHLT for more than 20 years. And currently, I'm a member of the steering committee of the Pulmonary Vascular Disease Network, and I'm representing the cardiology community.
Wonderful. And you talked a little bit about my next question, which is how you got involved in ISHLT. If you want to say more about that, or just tell us a little bit about what keeps you here. What is it about ISHLT that that you feel committed to?
Yeah, I think this is as I said, a very unique place where actually it's the only place where you can have all these professions gathering together, surgeons, anesthesiologists, cardiologists, lung specialists, nurses, pharmacists, I mean, just name them, they're all here, which is very unique. You don't find that many people gathering at the same place in the scientific society. This is what drives my interest. The other interest for me is the level of science that is an education that is presented by ISHLT at all of the levels of the society, and I really like that because when you're working in this end-stage disease, you need to have an eye on what's happening on the other side. So when you're in the heart, you need to have a look at the lung, and you need to have a look at what goes in the bloodstream, etc. So I think this interest and what keeps me in is there. It's really the multi-professional, multidisciplinarity, and of course, international is not there by chance. It's a clear value of this society to be international and to be there with colleagues who are not necessarily represented again in other scientific societies, like people from South America, colleagues from the Far East. And I think this is what I personally do enjoy and what keeps me in and kept me in for more than 20 years now.
Yeah, and it's really a case of diversity being the community's strength. It's right there in the name, and it's so wonderful that it's kept you involved. You talked about a little bit about, you're a cardiologist by training, you're involved in treatment of PVD. How did you get to where you are? What inspired your career path? How did you become interested in all of these things?
Oh, I would say it must be all about people. It is about the people that you meet, your mentors that you meet at a quite young age. We are, when you're training, when you're a physician in training, you're like an undifferentiated cell, like a primitive embryonic cell, and then you get differentiated by your environment. And this is clearly what drove me to PVD. I had a great mentor who taught me a lot about physiology. I worked in the fundamental lab. And I had mentors who were not necessarily part of medicine, who really inspired me in their philosophy and the way they are looking at life in general, which is much bigger than our profession. I learned to understand that in our work, sometimes the success we have may be undeserved, and all the defeats are unfair. And when you get that philosophy in, I mean, it's a good way to move forward in an environment that is sometimes quite tough. We're taking care of patients with very severe conditions, so you need to be dedicated to your work. So this is basically what drove me in, and what's still keeping me now in this work.
So as you've progressed through your career and stayed inspired, is there anything you'd like to share in terms of a meaningful milestone, whether it's personal or just something that's happened in the field of treatment research that you feel is really important to highlight?
There's so many milestones, Jess. I could spend hours to. Well, I think that one of the milestones to me was in research, to see that after spending years in the lab and looking at the physiology of the heart and the lungs, there was suddenly some sort of light at the end of the tunnel for patients, which is the first treatments for pulmonary vascular disease, and especially pulmonary arterial hypertension. This really changed the world, my world for sure, because we started to enter, and I was, in the mid-90s, late 90s, early 2000, the first oral treatments, first IV treatment and first oral treatment. This really completely changed the landscape of this disease. And, seeing where we are today, we have so many trials being done, so much research that is done, including with the support of IshLT, including by IshLT early career and leaders. It's just amazing to look back in time and see where we are today and where we come from.
Totally. And when you talked earlier about how it's all about people, that type of treatment and the change in how patients receive care has to be really powerful for you as a clinician.
Absolutely. It is very powerful indeed.
So when you think about, the journey over the last more than 20 years that you've been in the field, and when you think about the next 20 years, the future of the specialty, what's on the horizon for the treatment of PVD, PAH, all of those things?
I think we're now entering a very new era. We're moving away from the traditional three pathways we've been using, and the TILIN pathway, prostacyclin, and PDE5 nitric oxide, and we're entering something that is completely new, doesn't have anything to do with what we've done so far. I think this is leading us to have the hope that in the next 20 years, we will have treatments that do more than vasodilating the pulmonary circulation, but also changing the structure of the vessels, changing the structure of the heart. I think this is one big step, and that's the consequence of a very intense collaborative research. You can see that already happening today. This is not new. Collaboration between labs, between experts, even between junior colleagues, is something that is clearly that is going to lead us to something that is very different from what we've seen the last 20 years. And then finally, I think the way we are exploring the world with those treatments, when I started, the traditional trialists were in Western Europe and North America. Now we're seeing patients being involved in trials worldwide, pretty much worldwide. And I think this is a very big change that is going to accelerate in the future. For me as a human being, I cannot accept that a patient treated in developed countries is treated differently than a patient that is treated in a less developed country. And that's, I hope, is going to change.
It's like the best future outlook you could have, right? Is that equality and diversity of treatment that everyone is getting all of these wonderful new advances. So when you're not saving lives and thinking about the structure of the heart, what are you up to? What's your idea of a perfect weekend?
Perfect weekend would be probably having a good hearty breakfast on a Saturday morning, then going watching a game of my favorite soccer team with my son, um, probably reading a couple of books and taking care of my grandson, which is the our future and the my precious diamond. And that's probably what looks like what it looks like a very nice weekend.
That
And
sounds
no work,
great. And
no
no,
work.
right, and no work,
Yeah,
a full break with a full breakfast and a full
yeah,
family.
absolutely.
Well, Jean-Luc, thank you so much for taking time to chat with me today. It's always great to connect with you. Is there anything else you want to share with the IshLT community we haven't covered today?
Well, there's so many things I want to share with our colleagues. My hope is that we will gather together in Boston next year. I hope we will be able to travel. I think everybody's eager to have face-to-face meetings again. Of course, there are many things that can be done remotely, but the personal interactions that I personally value and that I'm sure our community at IshLT values is more important than anything.
Absolutely. I've said it in almost every one of these videos so far, but I can't wait to start meeting members in person. So I agree. Here's to a safe gathering in 2022. And thank you so much for being with me today.
Thank you very much, Jess. Bye-bye.